the Children of the 90s study is what we call a birth cohort. A birth cohort is a collection of people who are unified by being born at the same time. And in this case, as the name implies, they were born in the 1990s. In fact, they were born in an 18-month period leading on from 1990. And what we've done within the study is that we then follow those people, and that's 75% of all pregnancies in the Greater Bristol area. We follow them through time. And they're really kind because they keep coming back and doing questionnaires, giving blood, saliva, toenails, teeth, hair, all sorts of different things, along with their medical records, and then coming into face-to-face clinical examinations so we can measure their height, weight, bone densities, all sorts of crazy stuff. And we follow them through time. And that builds up a bank of samples, biological samples, and data that researchers can use then to answer important questions about health and well-being.
So recently this week, Children of the 90s was described on the BBC as Bristol's gift to medicine. So what is so unique about this study? And is there anything similar to this really in the world?
Yeah, it's a great question. So there are other we call them longitudinal studies, i.e. they operate through time. There are other longitudinal studies in the world, but there simply isn't another that goes from birth, in fact, before birth, because we recruited mums when they were pregnant. So from before birth for 30 years, so that length of time, and with the amount of data and biological sample collections that we have available, it just does not exist elsewhere. And I think, yes, thinking about what the BBC said about the study, I mean, it truly is. This is a study which is based in Bristol. All the participants were born here. They've generated an asset for the research world, which is second to none, literally second to none. And it will continue to be used for, for a huge amount of time and for a huge amount of different research projects.
So as you mentioned, the Children 90 study is turning 30, I guess, this year, over the next kind of year or so, really. And what sort of things has the study been able to achieve in that 30 years? And I guess, what are you most proud of? Is there a particular thing you're most proud of?
So when asked about the contributions that the study has made over the years, and importantly, just to say again, when I say contributions that this has made, I mean that the data and samples of the people of Bristol have made to research over those 30 years. I normally split things up into classic contributions and then more contemporary ones. So in the past, you probably heard about examples like the contribution of Children of the 90s, which is relating research on whether babies sleep on their backs or their fronts and how it relates to cot death. And that had a really important effect on policy for informing parents about how best to put their children to sleep. Other things were related to the presence of iodine, circulating iodine and supplementing iodine levels during pregnancy, which is really important for all sorts of health outcomes. But the study was able to look in large numbers of pregnancies at the levels of iodine and then correlate those to health outcomes in child. So again, you can use that evidence drawn from the population to inform policy that helps mums understand what best to do and doctors understand how to advise people about looking after themselves and supplementing their diet. Other areas, though, which are more contemporary, are really exciting. So the study has contributed to a better understanding of how our genes relate to complex things like adiposity, so how much fat you carry on your body. And that's rare instances of mutations that change people in a really big way, but also subtle changes that are really frequent in the general population that have a really, on average, shift in fatness in everybody. Along with that, there's been really good stuff to do with what we call normative data, so ordinary levels of measures for liver health. Now, in young people, actually, it sounds strange, but very little is known about standard liver health. Because, of course, most of the time, a doctor would see somebody when they're ill, not when they're healthy. But we're doing really fabulous work now at trying to understand what measures would give an indication of somebody's either very good or very poor liver health before they come to a doctor because they've got a problem. So it's really important in informing how you make decisions clinically. And then I guess one of the most recent, I'll give you two examples. So a recent example of a very impactful finding was the relationship between internet content and mental health and self-harm. So this is really sensitive as an area. It's a new stress and strain on people in the population of Bristol, and of course more generically those accessing internet content. Relationship between what people are browsing for and then their mental health and their well-being is really important. And that work has gone on to actually come together with the Samaritans and others to provide information to guide policy about the content of of material online to help people avoid worst case scenarios. And then the last point then is just, of course, to touch on COVID-19. In the last year, the study's probably been more busy than ever before. We've had, I think now, 4 different questionnaires that have gone out. We've had face-to-face examinations of people who've had COVID and recovered. We've been collecting blood. We've done antibody screens. The study's been very busy, contributed to policy directly to the Department of Education, Department of Health. It's fed into government SAGE meetings about the prevalence of the disease and what's going on with immune response. And that, of course, is because those in children of the 90s have responded to our requests and our pleas to do research and to help us. And it's been amazing.
Yeah, absolutely. I was going to touch on this actually, because obviously in the past year, the coronavirus pandemic has really brought into focus just how important population health research is in protecting the health of people and improving their health. And really, has Children of the 90s so far been able to give us any insights into the coronavirus pandemic, or are you planning to do that in a more retrospective way by collecting all of these samples throughout and hope to kind of study that as quickly as you can? Or is there already something that's kind of come out of this study that has been able to inform us about the pandemic?
Yeah, great question. You're totally right. So the pandemic has probably been the most graphic illustration of how valuable it is to have a study already going when something like this happens. And there really has been a sort of a call to arms to the study to contribute, and actually with our colleagues around the country who also have studies of a similar type to come together and help address the problems of the pandemic. I should say that this type of activity and contributing to important things like pandemics, it does happen all the time, but we often don't see it on the TV all the time. The difference here is that, the general population have had the BBC and others giving information every day about a targeted health problem. And so it is important to realize that Children of the 90s does this all the time, but we see it writ large with COVID. Now, there have been contributions already and really important ones. So a good example would be using the output from the first set of COVID questionnaires about symptoms and about lifestyle change and about the lockdown to understand the relationship between changing conditions, in particular when people are stuck at home, and mental health. And we work closely with colleagues at another study called Generation Scotland to report the relationship between lockdown and mental health. And what was seen very clearly was that there were big effects, and they differed according to the age of the participants that we were looking at. And it looked early on like actually those who were older were slightly more resilient in terms of their mental health to lockdown than the young. Actually, what's rather alarming is that those who are older are now catching up, and the effects on mental health are being seen more uniformly. But that's work that's come out immediately from the studies and has been directly contributing to policy around lockdown. But of course, going forward, we'll be using the data that we've gained over the last year. So we have a very substantial support now from the NIHR, which is, if you like, the research arm of the NHS, and the Medical Research Council, looking into long COVID. Now, long COVID is a funny thing because we don't really know what it is. It actually essentially captures anything that's happening after COVID infection, irrespective of whether it's a syndrome or not. But we need to define it. We need to understand it and understand, who's affected by it and how long it lasts. And again, so the data we have already and new data we're planning to collect will really contribute to the understanding of this grey area in COVID, and something which could be extremely important in the long term.
Yeah, I found it really interesting to hear what you just said at the start there about the kind of the stuff going on in the background in science is always there. There's always, the cogs are always turning, and then that's just been dragged out into the spotlight in the last year.
That's right.
Certainly on our show, I mean, I'm a kind of immunologist, biologist, and I have to go through all the vaccine stories every week and try and demystify all the science and try to kind of take the conspiracies and the actual concerns and try to kind of break all of that down into you know, make it make sense. And I think a lot of the concerns is that everything's just happened so fast in the last year, and of course it seems that way, but I think it really is important to emphasize just how much is going on behind the scenes constantly, whether it's to do with these sorts of studies you're talking about or vaccine development. These things have been going on for decades, and it's actually an incredible testament to the work that's been put in that we're able to get the answers so quickly and respond to this pandemic. And it's going to be really exciting to see what you can get out of this cohort.
You're totally right. And actually one thing, and the reason it's so important to have conversations with people like you, is that the pandemic has been just awful, and there are ways of getting around it and using studies like Children of the 90s to help. But if there's going to be a legacy from this, it's that the citizens of Bristol and others in the UK and elsewhere can contribute to situations that are bad by doing science with us and being part of it. Because without their data, and that might be something that's collected in a hospital or in a study like ours, you can't do this stuff. You just can't make a contribution. So as you say, demystifying, that's a great phrase. So taking the worry out of being part of science and getting people involved and being open and sharing, and also doing things in a judicious way, which are trusted and seen out, and very transparent. That's what we're gunning for. And if COVID does nothing else, then it might be able to illustrate that, which down the line, COVID, very important legacy.
Yeah, absolutely. And to some degree, it gives people an element of control back, even if it's, you can't really control much at the moment, but being involved at least makes you feel like you're being listened to and you're contributing. And I think that's so valuable, especially at the moment where people are just very panicked by the lack of control they have over their own lives.
Absolutely.
Going back to that BBC interview, Professor Jean Golding, who was the founder of Children of the 90s, said that the longevity of the study had really far stretched beyond her wildest dreams, and that she really only envisaged being able to follow the children up to around 7 years old. And so now you're at this 30-year milestone. How much further do you envisage the study going, and what are your hopes for the future of the study?
So look, the sky's the limit. There is no good reason that the study should have a natural end. So one of the things that is the hallmarks of the study is actually, whilst the study has run for a long time, we've been, in a very special position to be able to involve people throughout the different parts of their lives. And the original babies are now having their own families and children. And actually, so parts of the study now are growing. So we've got way more than 1,000 new children. So the children of the original children, if you see. And it's allowing us to, if you like, to chart and to measure that very, very important part of an individual's life. Now, we will continue to invite and continue to make it as easy and open as possible for people to contribute. And there's no reason why the study can't continue. We certainly have ambitions to track this next and critical phase of people's lives as they move through their late 20s into their 30s. They have a palpable difference in their lifestyles as they move either to different jobs or families or in and out of different social situations. So there's another period of flux. And it also offers us some really special opportunities. So for example, if we are interested in looking at, let's say, pregnancy, but in different environmental conditions and different eras, actually we're able to do that now and in a very unique way, because we saw the pregnancies 30 years ago. We're now seeing exactly the same biological event 30 years later in the same people, recording the same things, asking the same questions. And we can ask scientifically, what are the conditions now and do they make a difference? And actually, we've had some very important research come out suggesting that mental health, in particular for mum, has changed markedly over that 30-year period. And we don't know why. It appears to be more than just differences in reporting tendency. It seems to be that there's something going on, but you can only see that if you have the study running for that long. So to come back to your question, look, we want to keep going. We will keep going as long as the participants in Bristol will allow us to. And there is so much more we can do with the study. The appetite scientifically for the data and samples that are produced in Bristol is immense. We have more than 20 applications for trying to look at the data every month from different scientists around the world. So it's an absolutely demanded and cherished study, and we'll continue to keep it going.
Yeah, BCFM is a local community radio station, so we very well may have some original participants from the study listening to us right now, who maybe have drifted away from the study and are interested in coming back towards it. And is that an option for those people that have perhaps drifted away?
It is, absolutely. If you're born within the window of the 1990 to 1992, or you think you are, more importantly, you can absolutely get in touch at any time. So it's really, really easy. You can text your name and your date of birth to 07772 1999. Just go to childrenofthe90s.ac.uk, and there are details there that make it really easy to get back in touch. And there's absolutely zero negative effect of coming back in after a break. We would actively encourage it. The more, the better. And if you want to come back and take part, that our promise to all of our participants is that we're trying to make it as easy as possible. So it can be fitted in around your lifestyle. We can keep you involved if you want to, and on your terms, importantly. So yeah, we would actively encourage people to keep coming back.
Yeah, I suppose the one advantage of the last year as well is that we've just gotten so much better at doing everything remotely as well. So even if maybe it's logistical issues maybe prevented you from doing that before, I'm sure there's a bit more adaptation to being remote now.
Yeah. You're absolutely right. It's been a long-running ambition, actually, to make things easier for people. And one of the things we've had to do because of the pandemic is learn how to do it quickly. We started running and piloting, and now we have in full force what we call virtual clinics for our new families. And this is where packs of kit are sent out to our participants, and we have interactions with our field workers over the phone and on video links. And it means that wherever you are, at whatever time, we can act in a flexible and safe way to keep things going. And all of the learning that we've had over the last year about doing that and online questionnaires and so on, we're putting that directly into the design of our At 30 Years clinic, which will be a blended solution. So it will offer people a chance to help online, to come in face to face. So there'll be a mixture. So it will be hopefully as easy as possible, but also as flexible as possible. And the idea is that also, worst case scenario, if we go into a sticky situation with the pandemic into the end of the year, and who knows what's going to happen, but that activity won't have to stop. We can keep going.
Yeah, absolutely. So finally, looking back, and I realised that you, whilst you're leading the study now, you weren't there at the beginning. 30 years is a very long time. But if you could go back to kind of 1991, is there anything you would tell the researchers who were setting up the study that you wish they could have known, or even anything you wish you could tell them to do differently or give them a heads up about?
That's amazing. I've not really rehearsed that before. I've always been thinking about what's happening now, and I came into the study as a researcher and user of the study. So that was my introduction. Going back then, I think what was evident from all the conversations I've had with Jean Golding, about who's the original PI, is that it was really hard work at the beginning. Very, very committed participants, but on the ground in the study team, it was tough, and there wasn't a lot of support from funders, and it took a lot of energy to do that. And I think if I'd got the chance to go back, I would simply reassure them that it's time and energy well spent, because the breadth of the study and the structure and the continuity that it's put in place has enabled a breathtaking amount of contribution to not just things like COVID and that, but the science over the years has been really extraordinary, and so I would encourage them to keep going. Yeah,
absolutely. Well, thank you so much for joining us on the show. It's been amazing to hear what you've been doing, and I'm sure being in Bristol will be very interested to follow up on any more stories emerging from the study. I'm sure there'll be lots.
Absolutely. And I would just remind anybody who's interested in the study to get in touch. And indeed, if you think you're part of the study and you haven't been for a while, then do get in touch. So name and date of birth to 07772 1990. Just a simple text or SMS message, and we can get back in touch. So thanks very much.